So, motor neuron disease most commonly presents with upper or lower motor neuron signs or a mixture of upper and lower motor neurons. This disease affects limb muscles or those supplied by the cranial nerves. So, M and D. Now, this is a diagram here, and this will help you to understand this disease a bit more. So, in here, you need to understand how it works, how the motor neuron works. So, we have upper motor neuron and we have lower motor neuron. So, this is the motor, okay, not sensory, motor. Very important, you see in here, MND, motor neuron disease, it does not affect your sensory. It only affects your motor. It could be upper, could be lower, or it could be mixture of both of them. Okay. Now let's understand how the motor neuron, how it works. So in here, this is your brain. Okay. Let's get the pen ready. So this is the brain, and from the precentral gyrus, okay, you get nerve coming through, okay, axons coming through, and then it goes through all the way down the medulla, and in the medulla here, as you can see, most of them, they cross over to the other side in the medulla, and the ones that cross over will be innervating the limb, and others, they don't cross over, they continue straight, right? So this is called they innervate the axial. So as you can see here, let's zoom in here in the medulla. They are coming from, this is the motor, okay, motor neuron, okay. They're coming. Some of them, they go across same side, and others, they decussate. Now, when they enter the spinal cord here, this is the cross section of the spinal cord. These ones, the ones that have not crossed over, they're going to go down the anterior cortical spinal tract, and then they will basically cross over. As you can see, they're crossing over, okay, and then they're going to join in here. As you can see, this in here, we have their anterior horn cell. They're going to synapse with anterior horn cell. The ones that already crossed over in the medulla, they're going to come across, and on that side, they're going to basically go via the lateral corticospinal tract and then synapse with the anterior horn cell. It's very confusing, isn't it? So very simply for the exam, all you need to know is this. Just memorize this to understand purposes, that from the brain, they come down. Most of them cross over, the ones that are going to innervate the limb. And then they go to the spinal cord. And the synapse eventually where? With the anterior horn cell. Very good. And then from the anterior horn cell, we have a different neurons, different nerves coming. These ones here, they will go and they will innervate the muscles. So the key understanding here is this. There is a division. There is a wall, separation you need to know. One is called the upper motor neuron. And the other one is called the lower motor neuron. Okay. So anything from the cortex, the brain, all the way to the anterior horn cell, any lesions here is called the upper motor neuron lesion. Very important. Any lesion there is called the upper motor neuron lesion. Now the question is, what is the lower motor neuron lesion? The lower motor neuron lesion is from here, from anterior horn cell all the way to the neuromuscular junction. All of these, from the anterior horn cell to all of these in the nerves. So the nerves from here, it's getting a bit messy. So anterior horn cell to all of this. This is called, anything here will be lower motor neuron. Anything above the anterior horn cell, above the anterior horn cell to the cortex is called the upper motor neuron. Very important, guys. So we understand this now. Okay, in motor neuron disease, what do we have? The word motor is there. So this is affected, this is affected. There is a degree of clinical features. Some of them have only upper, some of them have only lower, and some of them have a mixture of both of them. Common thing is there is no sensory. So this is a nice diagram here, just for you to go over what are the features, clinical features of an upper motor neuron lesion and a lower motor neuron lesion. Remember, in upper, everything goes up. Okay, in lower, everything goes down generally. Okay, you'll have it in your own time. So, motor neuron disease. Now, there are different types I mentioned to you. Okay, and the types I mentioned here. Majority of them, the main one, the most common one, is the ALS, amyotrophic lateral sclerosis. That's the most common one. In this one, you have a combination of lower motor neuron and upper motor neuron as well. Primary lateral sclerosis only affects the upper. Progressive muscular atrophy only affects the lower. And progressive bulbar palsy, basically this one causes palsy of the tongue, muscle of chewing, swallowing. It affects the facial muscles. So there are different types of motor neuron disease. So as you can see here, important here are the clues here. So this patient has, in the exam actually, you're going to be, the main thing, the most likely they'll ask you is going to be here, this one here, where the patient has a mixture of upper and lower motor neuron lesion. So the patient is going to basically have fasciculation. So fasciculation is where? It falls under what? As you can see, is in this table. I have put it here as well. So fasciculation is going to be under lower motor neuron lesion. So the patient will have fasciculation. And at the same time, they'll say patient has maybe one of them, like increased tone. So it's a mixture, upper and lower. Then the answer is going to be motor neuron disease, most likely amyotrophic lateral sclerosis. Okay. Remember, guys, there is it does not affect the eye. There's no ocular involvement, and there is absence of sensory symptoms. Very important. Absence of sensory symptoms. Okay. Diagnosis for the exam, you need to diagnose it based on clinical features. So they will give you a patient with those signs and symptoms, is mixture of upper, mixture of lower. Okay.